Well, back with Dr. Pittaway. Dr. Pittaway, we have talked about missing teeth and that one can get tensions, headaches, and bad digestions, and even gum disease, which is not a good thing. But so let me ask you, what are some of the main reasons, main ways one can fix missing teeth? Because I know there's lots of them out there, and some are cheaper, some are more expensive. Tell us about it.
Well, Helmut, when it comes to tooth replacement, which is something we do a lot, there's 4 basic approaches. Number 1, do nothing. Well, that doesn't work for a lot of people. So a lot of people, that's the only option they have.
That gives tension, that gives gum disease, that gives digestion, so I can see why that doesn't work.
Well, you know, if you have a tooth that's unhealthy, if it's gone, then we've taken away that risk. So that's a good thing. But to have it back, to have the system working properly, we have the options of replacing the tooth with a removable appliance, a removable partial denture is called, or a fixed partial denture, which is attached to the teeth surrounding the missing tooth. And our best option for tooth replacement today is dental implants, and they are fantastic. My patients love them. You don't have to touch the other teeth. You don't have to have some piece of plastic you take in and out of your mouth. You can chew normally. You can brush and floss normally, and it's usually there for the rest of your life. So it's a great value, a great service, and I'm really glad that the technology has reached the point that it has with implant dentistry, because it allows me to provide a really great service to people who need their teeth replaced.
Okay, so let me ask you, when you said a fixed denture, so is that what you call it? Is that a bridge you're talking about?
Yes, that's a bridge, fixed bridge, and the requirement for that is the teeth in front and behind of the missing tooth have to be trimmed and prepared for a crown, and the missing tooth is attached to the 2 crowns in between. It's all one piece, and it feels like your own tooth. It fills the space. It looks good. That was the number 1 way to replace a missing tooth until implants came along, and we still do that sometimes. But if you have beautiful teeth in front of the hole and behind the hole, and we don't want to trim them down for a crown, that's when an implant is the most valuable, because it protects those teeth. Long term, you have a lot less risk, and we like to manage the risk and reduce the risk. So if you don't have those teeth trimmed down, given a bridge which has a short lifespan of 10 to 15 years, you can leave those alone. They have a better prognosis, and the implant will last longer than a bridge will. If you have the option, the price isn't that much different. So I usually recommend the bridge, the implant, as long as the bone is adequate to place it.
I got it. So you're saying the price isn't all that much difference. That's because you have one implant where, yes, when you do a bridge, you really actually have 3 crowns. So that's why it almost evens out, but it's still a little more expensive, the implant, right?
It's a little more expensive, but it's also, I would think, much more valuable, because let's say you're a 30-year-old man, you may have to have that bridge done 3 times in your lifetime, and maybe even lose teeth that the bridge was attached to. If you place an implant and leave those teeth alone, I think your long-term prognosis or outlook it's way better, much better.
At that point, it's definitely way better. Not to considering that.
And long term, you save a lot of money.
Right. And also, lots of dentists tell me that because you have a bridge, you have no space between the teeth, which means it's extremely difficult to floss. And even the good flossers have problems flossing as good as they should be. So if now all of a sudden you have to start using those needles or whatever you used to go through and floss, many people apparently don't do it. Now they develop gum disease in that area of the bridge a little bit or a lot easier than if they would have the normal teeth or an implant. Is that true? Have you observed that with your patients as well?
Oh, absolutely. In fact, that's one of the reasons that the bridges fail is, well, one, you've just changed 3 teeth. 2, the cleaning is much harder under the bridge, and people frequently get tired of doing it. I mean, they don't feel the gum disease coming on, so they don't notice it happening. Same with the cavities that start to happen down on the roots, under in between the bridge. And so it's much more of a problem. That's why the lifespan of bridges is short. I mean, I frequently see long-lasting bridges in healthy mouths, but there also are a great many that don't last a long time because of problems like that.
Well, thanks. I think you have shed quite some light on here on how that whole thing works, and I'm sure people will be able to contact you on the website which we show in this video and or on the phone number. Bye-bye, Dr. Pittaway.
Bye-bye. Have a great afternoon.
Thank you.